Hello, everyone. Hey, welcome back on the Shot of E&J podcast. This is myself, Eric Igwe,
My name is Jeremy Mensa, your co-host.
and we are back on season 2. So I don't know if y'all miss us, because like I said, we are back on
Hopefully
season
y'all
2.
do.
They got to. Because like I said, season 1, we went in, really good content. Wanted to make sure we get people educated on what's going on. Season 2 is going to be even more exciting. We're going to have a lot of great guests, and we're starting out with some amazing guests that Jeremy is going to introduce. But like I said, this is the start of season 2, episode 1. So hang with us throughout this whole season. Like I said, promise to give you a lot of exciting content. So let's kick off, Jeremy, with our guest.
So we want to thank you guys first for tuning in. We have some great guests today, friends of ours that have been rocking with us for a while. Our friend from undergrad, Emmanuel Chidi, pharmacy manager at UTMB and CEO of HealthE. It's been a pleasure just to see his growth and see where he is, and his lovely wife, Chidi Enwere, who is a family and psychiatric nurse practitioner. So we're just so excited to have them. We want them to just talk to you a little bit about what it is that they do.
Awesome, thank you. It's a pleasure to be on this podcast. I admire what Jeremy and Eric are doing. As Jeremy said, pharmacy manager for a health system. Definitely see the ins and outs of what's going on in the healthcare industry, and thought I would love to join and share my perspective. Also, the CEO of HealthE. It's an organization that focuses on wellness, and we have 4 pillars that we really want to make sure are the key to overall wellness, which is spiritual and mental wellness, relational wellness, financial wellness, as well as fitness and nutritional wellness. So with all of that, we offer a variety of services, coaching services, as well as just education in general. But thank you again, Jeremy and Eric, for this opportunity.
Hi, and my name is Chidi Enwere. Again, you guys, thank you so much for having us. This is our honor to be able to just kind of have a discussion with you all. I am a family and psychiatric nurse practitioner. I've been in the healthcare industry for over 8 years now. And in addition to being involved with HealthE, we also have a nonprofit known as Wellness Above Borders and Beyond. And that focuses on providing health services to people in underserved areas. We also focus on being able to provide healthcare services abroad and in other countries as well. And so it's just a real honor to be able to kind of share knowledge and be able to kind of talk about things that are important to us and passions that we have.
Absolutely. That's great. And like I said, we're looking forward to this discussion and what you both have to share. So now we got to get into our top 3 headlines. As you know, from season 1, we like to kick it off with our top 3 headlines, news and storyline across the country, across the world. Mm-hmm. So, Jeremy, what do you want to kick off with?
So I think the big news headline right now is the invasion of Ukraine by Russia, right?
Yeah.
And we're seeing things really come to a head now with a lot of the civilian targets that Putin is daily targeting, and it's just causing a lot of unrest in the world, right? When you talk about the economic impact of it and the trickle-down effect to other things, and obviously the atrocities being committed, it's very sad. It's very unfortunate. What I kind of see, as sort of the linchpin of this whole, how it's going to play out in the future, is what is going to happen with China and some of the other countries. How are they going to align themselves? And I think that's going to play a big role in how the response that Putin has to have to whatever their reaction is to, what he's doing. What are your thoughts about it?
No, I agree. I think it's going to, like I said, it's really going to come down to China. I think is going to play a factor because they have the relationship with Putin. Mm-hmm. It's intriguing to see, first off, prayers, to all the suffering in Ukraine. But it'd be interesting to see, like I said, how Putin's trying to, grow in Eastern Europe, and you have China and their actions with Taiwan, and and people worry about that too. And so it's going to be intriguing how the rest of the world handle this. I know President Biden's taking great steps with the sanctions and going after oligarchs and going after the different aspects of Russia. But it's going to be interesting to see what Putin does, because we all know Putin wants to control Eastern Europe. I mean, this goes back to the Soviet Union days, when Soviet Union had all of pretty much most of Eastern Europe, dominated Eastern Europe, and so he's trying to reclaim that. And so we're talking about Mr. KGB, Mr. Working intelligence. He knows it all. So it's a matter of understanding what's his end game going to be, how he's going to deliver this, because he has to come off as being on top, and so what does that mean? We'll find out. But I'm just praying that there is relief and countries really continue to step up and help those suffering in Ukraine.
Absolutely. Any thoughts on it? Any thoughts?
Yeah, I think for just what I've seen in the news and seeing that. Like you said, all the other countries are stepping up. I'm hopeful that, if obviously we don't want World War III, we don't want that, but we definitely want people to step up in a way that will cause enough pressure for Putin to stop doing what he's doing. And I just hope that the humanitarian effort continues to build up so that we are saving as many Ukrainian lives as we possibly can, because life is more important than any type of possession. You can get possessions back. We just want to make sure that the lives are saved.
Absolutely.
All right, so next topic, more on a lighter note, LeBron. I want to take this time to celebrate LeBron James. I want to, I was watching the game last night against the Washington Wizards. Yes, the Washington Wizards are not a good team, but the reality is LeBron had another 50-point game.
It's a sad day, though.
He had another 50-point game, carrying the team on his back. No Anthony Davis. Westbrook's have scoring problems, and I was watching this man carrying the team. He's 2 assists away from 10,000 assists. He's going to pass Karl Malone by the end of the season on number 2 list. He's doing it at age 37, 19 seasons. So I just want to give a kudos, shout out to LeBron. My wish for him is to win one more championship, all-time NBA. By the time he's done, he'll be NBA all-time scoring leader. He'll be hopefully top 5, and he'll be top 5 in assists. And then, like I said, he'll be at least 10,000 rebounds, and like I said, hopefully 5 championships. But anyway, to me, it doesn't matter because he's still the GOAT. He'll be the GOAT.
Hold on. Did y'all hear what he just said? What are your thoughts?
I'm from Ohio.
Okay.
And I went to school in Cleveland.
Okay.
So I give LeBron all the congratulations that I believe he deserves.
Yes.
Because honestly, I feel like at the age of 37, there are not many people who have done what he has done.
Exactly.
And so he deserves all the congratulations and adoration, all of it.
Chidi, though, is he the GOAT, though? Is he the GOAT, though? That's the question.
Well, in my mind,
Keep it 100.
there's always going to be MJ.
Thank
I
you.
will tell you
Thank you.
that LeBron comes.
Thank you.
I mean, he's right up there.
Let him get a couple more championships. We'll reassess the GOAT in a couple
He need a
years.
couple more championships for you?
Let me get at least one more, and we'll reassess after that.
I'm gonna say this too. Y'all forgetting about a very important man. You know what I'm saying? R.I.P. to the late great Kobe Bryant. That's my guy. So
He's your GOAT, or you saying he's your?
no, he's not the GOAT.
Okay.
MJ is the GOAT.
Okay.
Keep it one. I keep it
I wanna
real.
make sure.
But I don't know that LeBron has even surpassed Kobe. Is what I'm saying.
I mean,
Has LeBron played more years than Kobe Bryant? He
has. But
He
he
has?
don't have more championships though.
Okay, so let's reassess after that one championship.
Once he's all-time NBA scorer on the scoring list, he's top 5 in assists by the time it's done. 10,000 rebounds.
And he plays with his son too, right?
Right.
He writes history like that, then we can say it.
Oh man.
What's the last topic you got?
Let's talk about Ketanji Brown Jackson.
Okay.
Right. Been nominated. And you correct me if I'm wrong. I don't want to say this wrong, but been nominated for the Supreme Court.
Yep.
The Biden administration some would say that is their, I don't want to say crowning achievement, but they're delivering, right? This is something that they promised during the campaign that a lot of us were looking forward to. So I'm hopeful that she will be confirmed. I love the pick. I think it's great. I think it's been long overdue that we have a black woman on the highest court in the land. And I think hopefully we'll start to see an influence on a lot more of the jurisprudence that's coming from the Supreme Court. And it kind of, nice little segue into what we're talking about today. There's some healthcare implications about that as well. So looking forward to that. Your thoughts on that?
No, I'm excited. President Biden made this commitment while he was running, and he's fulfilling the commitment. So I'm excited by the pick. Obviously, well qualified. There's no question about that. And so, she's going to take over Breyer's seat because I think she clerked for Breyer.
Yeah, I think
for Justice Breyer. So she'll be taking over. And I just encourage, I just want people to sit back, check the process out. I know there's been news about some people question whether she's qualified. I'm like, her resume is impeccable.
It is.
Let's not use this as let's not bring, try to turn this to a racial thing and saying, and asking for qualifications. Like, her resume is impeccable. She's going to do great. Serving is great. She's got a lot of recognition, actually from both sides, both Democrats, Republicans, conservatives. And so I'm excited to see this pick. This is going to be historic. This is definitely a win. But it's not just for black folks. I think this is a win for the country. This is a win for kids today who are looking for role models, especially young girls looking for role models who can say, hey, look, anything is possible. So I'm excited.
I absolutely agree. For black women in particular, this is historic because there needs to be representation in all avenues in different industries. And for a young black girl to be able to see someone who looks like them in the highest role of the court is amazing. And so I'm rooting for her. I think it's an impeccable choice, and I'm really excited, honestly, for the country.
That's great.
Absolutely. Yeah, I think, like you said, this choice is going to definitely create opportunities for everybody. I don't think color should ever dictate, for one group or another. It's more of having that diverse group that makes the best decision for all. So I definitely support the choice.
Yep.
Absolutely.
That's great. All right, so when we come back, we're going to talk with two great guests, esteemed guests, and we're going to dive into the healthcare industry, COVID, the professions, among other things. So please come back on the Shot of E&J podcast. Hello, everyone. Welcome back to Shot of E&J podcast. We're gonna go into our main discussion, and so the first topic we're gonna have with our esteemed guest, Emmanuel Chidi, is gonna be about COVID. So, unless you've been in an isolated, island with no network, and don't know what's going on, everyone there's been, COVID, and especially the pandemic, has played a huge part around the world for the past 2 years. In fact, this is 2 years. We're just already past the 2-year mark of when COVID has been declared a pandemic, and when essentially the world was just shutting down. And so we want to talk to both you and Emmanuel Chidi on COVID. We want to know, the first question is, how has COVID-19 and the pandemic affected your profession?
I'll go ahead and let you start.
So COVID has affected nurses in so many ways. Nurses have been asked to go above and beyond, and they have been put in very dangerous positions based off of their, desire to help people. And it has been very trying, both physically, mentally. There's been a lack of initially PPE supplies. A lot of the nurses were asked to reuse supplies, or there wasn't enough supplies. I myself I was on maternity leave and went back to work shortly after the pandemic started, and there was just a lot of fear associated with the virus. There wasn't a lot of understanding. There wasn't a lot of studies at that point. And so I remember just coming home from work and literally changing in the garage out of fear to pass this virus to my family and my young child at the time. So this has been very trying for society as a whole, but especially healthcare professionals. In a positive light, though, there's also been some good that's come out of this. Healthcare has kind of expanded as far as like telehealth services, things that were perhaps not utilized to their full extent before are now being utilized, such as being able to speak to your doctor via telehealth in the comfort of your home for certain services that allows. For example, I'm a psychiatric nurse practitioner, so I see my patients via telehealth, and that allows them to, come to their appointments on time and be seen virtually in the comfort of their home. Another positive, at least for nurse practitioners, is that some of the scope of practice has expanded. Because this was an emergency situation, a lot of nurse practitioners were needed, and states where perhaps their practice was a little bit more restricted became less restrictive. Massachusetts, for example, allowed nurse practitioners to act or practice to their full scope of practice. So these are some advantages, but to be honest, COVID-19 has been trying. It's been difficult, and it's still difficult.
Yeah, I would agree. I mean, what she mentioned, it's been an impact on all areas of healthcare. It's not just nursing. Burnout is something that continues to get thrown around and around, but burnout is real. A lot of people on the front lines are struggling with just having the energy to go to work and provide quality healthcare for their patients. When you're dealing with very trying and taxing situations, you become very, apathetic, and you start realizing, is this all that my job has to offer? Before, when it was very, regulated and you didn't have a whole bunch of things thrown at you, but now with COVID-19, it is getting better now. But in the past year, there were so many different situations that people had to deal with. Over utilization of healthcare. People were coming to emergency rooms, urgent cares at alarming rates, where oftentimes they had to be admitted. There wasn't enough hospital beds, and there wasn't enough supplies. She talked about protective equipment for nurses and other healthcare providers to, prevent the spread. Right. As a pharmacist, we dealt with shortages of drugs, and those are very essential to providing appropriate health care to patients. And when drug shortages occur, it's very hard to provide the adequate care. And so you had to get creative. You had to look at different wholesalers. You had to reach out to different manufacturers, because every healthcare organization has different contracts that are set up. And when that provider of drugs isn't able to supply, then you have to set up another contract, and you're behind the queue of all the other organizations that have contracts set up. And so there's these rippling effects that are constantly just taking a toll on the system. So it's been interesting, and I know, as I mentioned before, burnout is not just affecting nurses, it's affecting pharmacists, it's affecting providers, and how we cope with it is very real, and trying to strive for just that balance. And so there's a need for more support in all areas of healthcare.
Yeah, absolutely. Those are, I think, some very important impacts to sort of acknowledge, you know what I'm saying, on society at large, but especially on you guys in your profession. We want to go back a little bit too, though. What are some myths versus facts that you can talk about with respect to COVID? Because I think there's a lot of misinformation out there, as we all know. And then I think there's just that general sense from people that we kind of wonder, okay, should we, what should we be doing in certain situations? Should we still be wearing a mask if we've been completely vaccinated, we've gotten our booster shots, these type of things. So if you guys could just talk about that a little bit as well.
Yeah, absolutely.
I think the number one thing is to get vaccinated.
Okay.
Get vaccinated, protect yourself. Study after study has shown that vaccination significantly reduces significant infection, as in death or hospitalization. And so you're not only protecting yourself, but you're protecting your community when you get vaccinated. So I think that is the number one thing to remember. There have been, as you mentioned, a lot of misconceptions about the vaccine. A lot of people, I've heard myths such as it was rushed or that it changes your DNA. There's a lot of misinformation out there. The key thing I believe to remember is that this vaccine has been studied to be safe and effective. It is not a new technology. This is something that was studied even years before the pandemic. The mRNA is what I'm referring to, which is what Moderna and Pfizer utilize. It's a technology that was studied years before its utilization, so it was not something that was perhaps brand new. It does not affect your DNA. The way that it works is that it creates a protein in your body, so that if your body were to come in contact with COVID, your body will now remember and elicit a appropriate response, and perhaps help you be protected from that virus.
Absolutely.
So,
yeah, and one thing that is very clear, what you said, it creates that protein. It doesn't enter the nucleus of the cells, and that's what people are feared. They're fearing that it's going to alter their genetic makeup, but that's not the case. And it's very important that, like Chidi mentioned, this has been studied for several decades, and it was actually studied specifically for rapid, research and development in terms of like pandemics when, certain abnormal, infections do arise. And so they were prepared way before, their time. And honestly, if this technology wasn't studied for this long period of time, it might have been several years before a vaccine would have been developed. Ooh. And so what people need to realize is the studies are very, very clear. If you do not get vaccinated, you are predisposing yourself for severe disease. You have a higher likelihood of being hospitalized. You have a higher likelihood of dying from COVID-19. It doesn't matter if everyone around you is vaccinated. The best thing you can do for yourself for protection is to get vaccinated. And one thing is for sure, this vaccine has been out for over a year now. So we have several studies going on. When the initial studies came out for Moderna and Pfizer, both of these vaccines were over 94, Pfizer being 95%. With the initial studies, there's other studies going on now, but the initial studies showed Pfizer being 95% effective, while Moderna was 94%, effectively the same. There's another vaccine, Johnson & Johnson. It's a one-shot regimen, but it had lower, efficacy than the other mRNA-type vaccines. But overall, all three of these vaccines prevent severe disease, which is most important. Many of the people saw that the rates of COVID went up around the January time period when that new variant came around, the Omicron. Yeah. Well, because a lot of people were vaccinated, they saw that there were lower rates of severe disease. The hospitalization rates were way down compared to what they were before people were having vaccinations. And so it's very important to keep everything in perspective.
Yeah, no, that's real. Wow. Yeah. No, we appreciate you sharing that. Because I think, like I said, you hear people like, "Oh my gosh, this vaccine is gonna, take my DNA or affect my DNA," and there's a lot of information spread around. So it's good to hear about the history of the mRNA, especially how this has been studied for a while. And so appreciate you sharing that. We wanted to go to prescription drug. Oh, do you have something?
Yeah. So, and we can definitely segue into that. One thing, though, I want to get you guys, I guess, recommendations or advice on. So, especially in the Black community, right, we have a lot of, I guess, historical situations where Black people have been put in situations where we would not as readily trust the medical community. There's a book, and the author's name is missing me right now, but it's called Medical Apartheid. I'm sure you've heard of it. And so you have those of us in the community who would push back against, getting vaccinated and what have you. What is your response to them? Because I do think that it deserves a conversation, and I think vaccination, like you said, is important. It's something that we should be pushing. But I don't want to ignore some of the past reasons why, individuals may feel a little bit uncomfortable with certain things that are coming from the medical. I mean, we think we have to address that as well, just to be fair.
Absolutely.
So what are your thoughts on that?
Absolutely. I think that it's warranted, unfortunately. Historically, we've had many cases where people from the African American community have been disenfranchised from the medical community. However, we do have to make sure that we base our decisions based off of science. And so study after study show that these vaccines are safe and effective. And I think one thing to remember is that the African American community already is disenfranchised. And so they, more than anyone, deserve that protection that this vaccination can offer. But that being said, it's completely understood, knowing the history of, unfortunately, this country and different things that have been done to the African American community. So it's not necessarily ignoring that, but also looking forward, basing our decisions based off of what would be most beneficial to that community.
Absolutely. And I just want to add, being in healthcare, maybe I might know a little bit more than the person who's not in healthcare.
Right.
I think there's a lot of people in the African American community who can share the knowledge. And I think that's the key, having the knowledge. If you are basing your decisions on the past, you cannot make educated decisions. And so for me, with, like she mentioned, our nonprofit earlier, Wellness Above Borders and Beyond, we've given several presentations where we just educate the community and provide updates on COVID-19, wellness, better eating habits. And when we do that, it opens up a dialogue. It allows people in disenfranchised communities to ask questions and really clear things up. We're able to share some of the studies that have been done. There, like she mentioned, there's several studies that have been done that show the efficacy. And when the FDA stamps their approval for something, that means that they don't just do that without any without like a blind eye. They make sure that they go through the appropriate tests. They go through the appropriate approval processes to get that FDA approval. Even though these were well studied, even when they were in emergency use authorization status, now Moderna and Pfizer are both FDA approved. So, and they're available to children 5 years old and up. So, for them to stamp that approval, and let me clarify one thing: Pfizer is available is FDA approved for children 5 years old and above. They're still doing studies on Moderna, but for them to do that, they have been put through several tests to make sure that this decision is appropriate. So I want that to be clear. Some of the past decisions related to vaccinations where, that have caused a little mistrust, those were only studied in African Americans, and there wasn't really a widespread information about how those studies were going on. So that's why I think there might be some mistrust in that.
And just to piggyback off of that, I think this is kind of goes back to what we talked about representation. That's why it's good to have people from all different backgrounds in the healthcare industry, so that when someone is telling you that, or advising you, let me say that, to get a vaccination, this perhaps might be someone that you are easily able to trust, because they represent where you come from. They represent what you look like.
In fact, I'm be honest. Full disclosure. Part of the reason I went for got the Moderna vaccines because I saw this sister who's a scientist. She was one of the face of it. I forgot her name, but she was the face of it and helped to build that vaccine. I was like, all right, they gave me some sense of
a little
assurance.
bit of trust.
Yeah, absolutely.
That's real.
We want to go and talk about prescription medicine. It's a hot button issue, especially among the industry, and especially you hearing that Congress are trying to make attempts to help reduce the cost of prescription medication, prescription drugs. But based on your experiences, why are prescription medications so expensive? Come on.
So I kind of alluded to it earlier, but one of the main reasons why prescription drugs are so expensive is because of the drug shortages that are going on. If you all know, when a drug is created, there's active ingredients, which is the chemical entity, and then there's inactive ingredients. If any one of those ingredients there's a lack of, it causes a supply issue. And y'all know from economics, if there is a supply issue, it affects the demand. And so if there's a higher demand for something, prices often go up. And so we're seeing this not only in hospitals, but we're seeing drug shortages in the retail sector, the community pharmacies. And whenever we essentially see that, it might cost more to obtain certain products to create drugs, and that drives prices. The other reason is, pharmacy benefit managers. And pharmacy benefit managers were actually created to do good, but there's a lot of concern, and I'm not gonna, I don't want to bash them completely, but there's a lot of concern that they are not always doing what's in the best interest of patients or just the insurance companies. So pharmacy benefit managers, for y'all that don't know, they essentially are the middleman between insurance companies and the patient. And so what they're in place to do is they're in place to essentially negotiate with manufacturers to get the best pricing for insurance companies, which will keep your copays low, keep just overall costs of drugs low. That's what they were created to do. They have specific formularies. A lot of them have specific formularies where if you take drugs on that formulary, usually you'll pay a lower cost than if you were to take, other drugs that aren't on the formulary. So obviously there's generic drugs, there's brand name drugs. So taking a generic drug, you might save a little bit more money than if you were to take the brand name drug. And so, pharmacy benefit managers are supposed to kind of control all that. One thing that people don't know is when they negotiate all of these contracts, they get rebates, which are kind of, I call them kickbacks to the pharmacy benefit managers. They don't always disclose that to the insurance companies or the amount that they're receiving back. So sometimes they just pocket it. There's other just costs that they'll add into, like markups and fees that they will just kind of set as their system prices, and that they'll work with the pharmacies, and they'll say, hey, this is how much we're going to pay for this drug. And so the pharmacies, their margins get squeezed when they're like, okay, we're only going to pay X amount of dollars for these drugs. And so all of these are factors to increasing drug costs.
Wow.
Yeah.
So when we get back, we're going to continue the prescription medicine discussion and then go into opportunities for African Americans in the health industry and mental health. But because we got to dive in, you dropped some heavy information, so we got to definitely dive into it. So everyone, please get back with us. Come back on the Shot of E&J podcast.
Hello, family. My name is Jeremy Mensa with a Shot of V&J podcast. We want to continue our conversation about healthcare, and we want to kind of finish up this discussion we're having about prescription medication pricing. And so what we wanted to ask our guests now is, how are the higher costs affecting patient care?
Okay. Well, I can just speak to what I've experienced with my patients. Unfortunately, sometimes I will prescribe a medication and they will not be able to pick it up because of the cost. And ultimately, that leads to delayed patient care. For example, I might prescribe a patient a medication and not see them, of course, scheduled until weeks later. And so the patient goes without that medication for weeks. Then when I see them next, they now tell me, oh, this medication was too expensive, and I now have to, or, part of our team has to do a prior authorization, which again delays patient care. So it is definitely a problem because the ultimate reason why I prescribe that medication is not being addressed. And so the patient's going without care for that period of time. There's also patients who sometimes will prefer one particular pharmacy and they're not able to go to that particular pharmacy based off of their insurance. And so sometimes that just allows for a little bit of disorganized care. They'll ask me to prescribe it to a particular pharmacy, and then we have to switch the pharmacy because the cost was too much. And so, there are a lot of breakdowns in our system, unfortunately, when it comes to prescription drugs. And so it's something that needs to be discussed and addressed a little bit more.
Absolutely.
Yeah, absolutely. And I'm hoping that, people listening, and hopefully our legislators are listening.
Yeah.
I know they're trying to do some efforts to reform prescription medication and the system around it. Absolutely. So we have to stay tuned and hope that change does come and really put pressure on our lawmakers. I do want to segue into opportunities for African Americans in the health industry. And so I was taking some time to look at the data, and we saw around less than 10% of African Americans in both, we're talking about as pharmacists and nurse practitioners, we have less than 10% of African Americans serving either as nurse practitioners or as pharmacists. And so based on hearing that information, what are some steps that can be taken to help increase the presence of African Americans in those respective fields?
Yeah, that's great. Yeah, the rates are low compared to the population of African Americans. I believe our U.S. population of African Americans is around 13-14%, and there's definitely going to be health disparities when you don't have a diverse workforce that represents your population. And you said it correctly. Those numbers are below 10%, so we're not even halfway. In some areas for our population. One way that I know would be helpful, and I used to do this when I was in pharmacy school, and I actually hope to do this as I kind of continue to establish our nonprofit and grow from there, is doing outreach to middle and high school students, especially areas of color. When I was in pharmacy school, I used to be the chair of the outreach committee for one of our organizations, and we would go to all the different schools in the area, and we would just speak to the students about pharmacy and how what's the pathway to pharmacy. And I think that can be done in any profession: nursing, medical doctors, essentially any healthcare profession. We really need to advocate in those communities of need, because those patients that are often not receiving healthcare in some of those communities is because they don't have good representation.
Just to piggyback off of that, I believe starting young, starting with programs like you mentioned, that children of minority groups are able to see people who look like them in professions that they might not have before considered attainable to them. And then secondly, I think that when we actually talk about the schools, like the schools of nursing and medicine, pharmacy, etc., there needs to be leadership that is diverse as well. So professors and administrators who are diverse.
Yeah.
And sometimes that helps for mentorship, being able to expose students to different opportunities, because retention is also a problem. Sometimes students are in the program and they do not feel supported, and therefore they are perhaps dropping out. So, I mean, there's a multi-focal approach that needs to be addressed when we talk about the healthcare industry.
Absolutely.
Yeah. Before we go into mental health, I just want to ask one more. What would you say is like the top 3 professions within the healthcare industry that people should like pursue as a career? I mean, like just, based on everything that's going on, you've seen the growth of the health industry. If you have kids watching it right now, like, or parents watching, like, let me see that. What are some popular fields that people should look into get into?
Well, I think that the world in general is moving towards technology.
Okay.
So health informatics is something to really consider. As I mentioned, telehealth is expanding. So finding avenues in that. Patient care, I believe, is always going to be needed. So whether it be in nursing or as a physician, there's always going to be a need for that. So that's just one thing I can think of.
Yeah, absolutely. I think, a lot of people nowadays are educated, and we're empowered to make a lot of healthy decisions for ourselves. And I think, if we're talking specifically about healthcare, I would encourage people to seek out, career paths that are on the outpatient setting and empower patients to, seek and do what's best in terms of wellness for themselves. A lot of people, they don't get regular checkups every year. And many insurance companies, those are free benefits that come with many insurance companies, getting a physical and wellness checkup every year. And if people did that, we would probably see lower rates of severe cancers or lower rates of just severe disease, because you're regularly getting a checkup. And so when you're in that pre-state of whatever that disease might come, you're able to catch it. You're able to start making lifestyle changes that would prevent that. So I see a huge opportunity for primary care providers. Nurse practitioners are stepping in a big way in helping out in the primary care arena. So I definitely, just see growth in that area. We want to be honest with you, we as a community and world will be way better, and I think more money will be kept in the economy if people are healthier.
Very
So
true.
That's real.
Absolutely.
Very true. And I think remembering that this not just like that there's a lot of avenues in healthcare. So obviously there's physicians, there's nurses, there's also people who work on the backside, who work with electronic medical record systems. And so there's just a lot of different avenues where you're still impacting lives, but perhaps patient front-facing care is not for you. And so just exposing children to as many professions as possible is key.
Okay, that's great.
absolutely.
Now, mental health, and Chidi, because you were a family and psychiatric nurse practitioner, so, and like I said, in the midst of the pandemic, you've seen a lot, and got a lot of feedback and seen a lot with your patients. So, what has been some of the things that you notice as far as like, the mental health aspect, as far as based on dealing with patients or just dealing with people what are some things, what are some warning signs you've seen, what are some things that people should be aware of when it comes to taking care of the mental health?
I think that thankfully as a society, we are beginning to understand that physical wellness and mental wellness are equivalent and they tie hand in hand. One of the things that COVID-19 has exposed is that isolation is harmful. It's stress literally on your body. And so I've noticed that within the COVID-19 pandemic, a lot of people suffered from that isolation, and it led to higher rates of anxiety, depression, even with healthcare providers, PTSD, seeing, unfortunately, people pass away that they were taking care of. And so mental health is very vital. There are a lot of key things that I would recommend for people. Number one is socialization. Talk with your family and friends, not just virtually, although there is a place for social media, but not just virtually, but face-to-face. Have those conversations, talk about your feelings, reach out to friends who perhaps you have not seen in a while. And then I would strongly recommend, especially within the African American community, to embrace the idea of therapy. A lot of people are dealing with similar issues, and just being able to talk to a licensed professional can be key. So embracing the idea of therapy, family therapy, is something that I think will be beneficial for many people.
Absolutely.
So, and I think you hit the nail on the head with us as a community embracing, mental health. Do you think, how can we have ways for better outreach? Should we be, putting more mental health programs in the schools? Should we be, maybe having some more public campaigns through, local and city government? What are ways that we can really, I guess, get to people and kind of put that message out? Because I think, like you said, mental health has definitely risen, especially over the past couple of years, in terms of its, importance, and people kind of realizing that, hey, it is a big deal. You need to take care of your mental health. But I think also actually like carrying it out where people have the resources, the access to the resources is a part where there's room for improvement.
There's room for improvement. And I think that some of the things that you mentioned are key within our healthcare curriculum, perhaps including mental health, signs of depression, giving people resources. If you have a friend or family member who might have suicidal thoughts or ideations, being able to reach the inner city communities, especially where sometimes the idea is just to push on, work harder, ignore your feelings. Making it normalized is the key. And so I think that happens on many different levels. One of the good things I've seen with this pandemic is many new companies advertising therapy options on the internet. So it's not unusual to see advertisements now, and I think that's moving in the right direction.
Definitely add that with the burnout that you're seeing in a lot of healthcare professions, people are starting to realize that in order for us as a healthcare provider to provide adequate care, we also need to take care of ourselves.
Right.
If we aren't taking care of ourselves, how are we going to provide appropriate care for the patients that need it? And so, for me, being in management, I still staff to see and be able to understand what the front line is going through. But I do have to realize that in order to make change, you have to be able to truly understand what everyone's going through. And so working with your employees, working with administration of different areas, having these dialogues, not being afraid to ask, can we have a longer break? Can we, have a mental health day? Stuff like that can be a game changer in terms of just making you do better in your job. I know for me personally, after I get done with work, maybe taking a walk with my family can help, kind of separate, that work and go mentality and just being able to catch up and slow down. Picking a hobby or an activity, whether it's, working out in the gym or, for me, it's playing golf. If I can find, a few hours to get away and play golf, I truly just feel like, I'm just kind of like detached from all the stressors of life. And so when I come back to work, or if I come back to dealing with family issues, I'm approaching it with a different perspective.
That's key.
That's wonderful. And so before we conclude this discussion, and we thank you both for definitely coming along, and like I said, we learned a lot. I've learned a lot from this discussion today. So, and I know many people watching will take a lot from this and really make some changes. And so, thank you for that. But we want to please, before we conclude, please talk more about your nonprofits, and then talk about how can people reach you. If they got questions about your nonprofits or interest in the nonprofit.
Absolutely. Go ahead.
So, as my husband mentioned, we are a part of an organization known as HealthE Squared, and we really focus on holistic care. We really try to guide our clients to finding ways that are individualized to them, that can offer them support and resources to live happy, healthy lives in all different aspects of their life. And so we can be reached on all social platforms, social media platforms, and it's a passion for us. We really just like to come alongside people and really help them in their day-to-day habits and practices.
Absolutely. So the platforms, the social media platforms, Instagram and Facebook, HealthE Squared, you should be able to find us, follow us, show support. If you're interested in any services, feel free to reach out through those social media platforms. And she also mentioned the nonprofit that we have as well, Wellness Above Borders and Beyond, abbreviated WAB. You can find it on the social media platforms, WAB Health. But WAB really is our way of just truly just giving back and being able to serve our community. Like we mentioned earlier, we've done several presentations about just striving for overall